With just a few weeks until their due date, Crystal and James Burford are preparing as best they can for the arrival of their son, Jeremiah. Their unborn baby has a life-threatening heart defect called hypoplastic left heart syndrome. Around 900 babies in the United States are born with this condition each year, where the left side of the heart is underdeveloped.
So we deal with approximately 10 to 20 babies who have hypoplastic left heart syndrome or related variants every year. So we have a good deal of experience in dealing with this type of cardiac physiology and with the surgeries required and the care required after such a big time surgery in these little babies.
Crystal will give birth at UAB's Women and Infants Center. Then the medical team will move Jeremiah to Children's of Alabama, where he'll have the first of 3 surgeries to correct the problem.
Neither one of us have been in this situation before. I've never been in a NICU. I've never seen a small baby, have an operation. So that part I worry about because it's the unknown for us. We've read a lot about it, and we've tried our best to prepare ourselves.
Just a few days after his birth, Jeremiah will have an operation called the Norwood procedure. Surgeons will create a new aorta, which enables the right ventricle to pump blood to both the lungs and the rest of the body. It's a difficult surgery and can be very emotional for parents.
One of the most dramatic things to see is your baby who goes into an operation, who looks like almost any other baby, and then comes out with a large incision on his or her chest, sometimes also with what's called an open chest, where there's just a bandage overlying the heart, but the actual chest is open. There are oftentimes multiple chest tubes, multiple catheters. There's a breathing machine, and the babies are asleep, not awake. And so that can be difficult for a family to see immediately after surgery.
Crystal and James are preparing as best they can for what lies ahead.
I'm grateful that we didn't find this out the day of his birth, because I can imagine how devastating that would be for somebody to have to deal with that on the day that their child's born. At least we can have a plan in place.
Fortunately, ultrasounds have shown baby Jeremiah's heart is structurally sound otherwise, which means caregivers can create a roadmap for care.
We know about the condition. The baby will be born at a major center here at UAB that frequently deals with this type of cardiac defect. In addition, the connection between the 2 atria appears to be wide open, the heart function appears to be good, and there's not much valve leakage present.
When I've told other people, I'm going to have the baby at UAB and this is where we're going to be, and they're like, you're in the best place. You're so lucky that you live close to where you can, use this hospital.